session. It is for fundamental of nursing lab. We will start with the mobility and the condition that that is associated with mobility. So, under the condition which is related to mobility and that we have to deal with is the pressure sore. Did you hear about the pressure sore? What we mean? Is there any other name for it, by the way? Bedsore, yes. Why it is bedsore? Why it is called bedsore? So because, yes, thank you, because it is related to bedridden. It is related to presence of the client or in bed for a long period of time. So it is related to immobility. Did you saw any case with a bedsore?
No.
Still you didn't, because you have no clinical experience, so still you didn't have any experience with those patients. So those are some photos of the bedsore, but we will talk about the stages and what is the possibility of causes of that bedsore. Did you talk with Ms. Spency some of the causes and related factors that might lead to bedsore? Can you remind us with those conditions? What are the conditions that, or the factor that will increase the possibility of developing bedsore? What are the factors that increase the possibility of developing bedsore? Coma, patient in coma. So unconsciousness, it means if the patient is unconscious, because coma it might be for temporary unconscious for a long period of time. Yeah, okay. What other factors?
Stay in one position for a long time.
Staying on one position for a long period of time. Yeah. Friction. So friction also it is from the causes of bedsore. What other cause? What other causes? What other causes? You mentioned presence of in bed for a long period of time. Is there anything which is related to that also that might increase the possibility? By the way, if we are taking care properly for the client, mostly he will never develop bedsore. So if we maintain the cleanliness of the client, if we maintain the change of position regularly, if we maintain the nutrition of the client properly, if we maintain the cleanness, it is related also to the moisture and avoiding of moisture. We are keeping the client dry. Almost all of those conditions, it will help in the prevention of bedsore. So mostly he will not have bedsore. Even if bedsore is there, if we are giving those care properly and regularly, bedsore mostly it will heal. So maintaining nutrition, good nutrition, maintaining cleanliness, and prevention of wetness, and also, which is keeping the client dry, changing position, frequently changing position. Those things, it will prevent the bedsore. So, what is the bedsore? In definition of bedsore or pressure sore, it is called pressure sore, are also called decubitus ulcer or ulcer or bedsore. So, it is a major complication of immobility. So, it is from the major complication of immobility. It is due to interruption of blood circulation to the tissue resulting from localized ischemia. Do you know what's the meaning of ischemia? Ischemia, it means loss of blood supply to an area. It is called ischemia, the abbreviation from, because if there is no proper supply of blood to a tissues, what that mean? The tissue will not get oxygen, the tissue will not get nutrition. So ischemia, it means that loss of blood supply means loss of nutrition, loss of oxygen. So how the tissue will survive without oxygen, without blood supply? So localized ischemia, which is the abbreviation from oxygen and nutrition to the part, as a result of tissue, the tissue will have necrosis and the tissue will die. So that necrosis, it will appear as a bedsore in the client. It might start from superficial to end, and it might sometimes start from inside. So, now, the causes of pressure sore, from its cause, there is friction, pressure. So when, according to the position that we are assuming, there are a pressure point in our body, especially that pressure point in the site of bony prominent area. In our body, we have some bony prominent area. That bony prominent area, the bone, it is covered by mostly the skin. So there is no cushion in between that keep some or distribute the pressure. So due to that curve, because we have some curves also in our body, those curves also, it will make some area that the pressure, it will not be distributed in the most of the area that we are, or most of our body. So, if we are assuming semi-sitting position, like this patient, here, see the area that has contact with the bed. So it is a pressure area. So here, the back of the head. The back of the head, it is the pressure of, or the weight of the head, it is against the bed. So if it is for a long period of time, especially in a debilitated patient, the skin is thin also. So that pressure, it will prevent the blood from passing through that area. This will increase the possibility of developing bedsore. Also here, see on the back, also the pressure is creating, and there is also another force which is there, which is called the friction. friction because here by the gravity is pulling our body downward, and the bed, because we are in contact with the bed, the bed, it will take the tissue upward. So the weight of the body is going downward and the bed is taking our tissue upward. So it will create what we call it the shearing force. Shearing force. So two forces are shared and they are against each other. Like if we are getting something in between two persons and everyone is trying to catch it toward himself, what will happen to that portion or to that thing? Sometimes it might tear. So this is the shearing and the friction also in between the two surfaces. In the buttocks here and in the thigh, there are the area which has a pressure here in this position, the heels. So in this position, those are the part that is more exposed to pressure. So in this position. So according to the change in our position, the area will be changed, the area of pressure. So whenever we are putting the client in a position, those areas which we expect that pressure is more on them, we have to do something in order to distribute the pressure. When the pressure is distributed, this will alleviate, this will prevent the consequence of that position. And when we are changing the position frequently, also this will help in many ways by keeping that part dry. When we are keeping ourselves in a certain position, that area which has close to other surface, there are many things that will happen to it. One is the pressure on them. The other thing is that they are not aeration. There is no circulation of air around them, which will keep them dry. Also, their sweating might be there. So this will make the area wet. The wetness and darkness also due to closed contact with other surface, it will enhance also the growth of microorganisms if we did not clean the person well. So always we have to clean also the client who are confined to bed. He is in need for more cleanings. There are many conditions that might aggravate those conditions, as we said before, that you did not mention it, that those patients, if the patient is having incontinence, either urinary incontinence or fecal incontinence, this will aggravate the problem because you know that the urine is acidic, and when it is in contact with the patient body surface, it will lead also to increase the possibility of irritation of the skin, and by the time it will lead to formation of a bedsore. So the area that's susceptible for a pressure sore, the occipital area. This is when we are lying in our back. If we are lying on a side, our ear also is expected. Here, we said that mostly the pressure sore, it's happened over the bone prominent area because the skin cover over it, it is less. So the pressure, it will be more. And the weight of our body, it will come mostly over those bone prominent area, isn't it? So we have the scapula here. You see that this part, it is prominent. And also, there is no tissues support the elbow. The sacral region, ischial tuberosity, down here. Greater trochanter, in the femur. Medial condyle of the tibia. Fibular head here. And the medial malleolus and lateral malleolus, the heel. So those are the area, prominent area that the bone is not covered with too much tissues, which increase the possibility of formation of bedsore on them. The categories of pressure sore, when we categorize them, there is might be a superficial ulcer, which is most often result from friction. It is start at the skin with exfoliation, or if it become deeper ulcer. So it will start with change in the color. It will start with redness. Then it will start, then after that, if we are not taking care of it and preventing it, in this case, it will, necrosis will become there, and it will become deep and deep. Deep ulcer, which is mostly result from shearing force and the pressure, starting at the underlying tissue, so it might start from inward, and it is coming upward. So it might start from the deeper tissue, and then it will come toward the skin, over a bony prominence area, and extend upward to the cervix. So it starts from the deeper tissues and coming upward. So the stages of development of superficial pressure sore, which is what we call it transient circulatory disturbance. So there will be circulatory disturbance, mean that the blood supply is becoming less to that area. That, if it is for extend to more time, in this case, this will lead to permanent damage to the superficial blood vessels and tissues. So the superficial blood vessels and tissue, it will be damaged. Then it will lead to deep penetrating necrosis. Deep penetrating necrosis there. After that, those dead tissue and debridement, it is a good media for bacteria to grow if we are not taking care of it properly. So bacteria will grow there, so it will get infection. So the ulcer, it will get infected. So in stage 1, it will be redness. So you will notice redness of the intact skin. The skin is still unbroken, but it is inflamed, and maybe it might be maybe painful. If the temperature of it, due to inflammatory process, it is warm to touch. You might also notice the skin texture, maybe spongy or firm, either spongy or firm, the texture of the skin. In stage 2, here you will see that the first sign of skin breakdown, the skin start to have some breakdown. So you will find some necrosis within the skin. And partial skin loss will be there. It will look like an abrasion or blister, like in case of burn. Did you see that blister, which has fluid inside? So it's the same. So the outer layer of the skin is broken and red. It is painful. The surrounding tissue may be pale or red and swollen. The surrounding tissues around it. The stage 3 and stage 4 to result in ulcer production. So you see that ulcer is there. Deep tissue necrosis is there. Loss of tissue is there here. So result in ulcer production. The skin has broken down at their extensive destruction or damage to the underlying muscle. Even it might reach to the muscles. And it might reach even to the bone in a deep ulcer. Or the supporting structure. Ulcers are extremely difficult to heal in this case and may take many months for complete repair. So anything that can prevent the development of the ulcer should be considered seriously in order to prevent the consequence of those ulcers. In assessment of bedsore or ulcer, in any, you took the health assessment and assessment of the scan. So if you find any lesion, what are the things that you have, or what you are looking when you are assessing the skin of client?
Color.
You are looking for the color change, not the original color of the patient, I mean. So what's the change in the color and the site of that change? If there is a change, what kind of change? How is it? Sorry? How is that change? Is it paleness? Is it redness? Is it cyanotic? So it depends upon the what other things that you are looking for. If there is any lesion, what you have to assess? If there is a lesion, it means that it's wound or destruction of the tissues. So what you are assessing in this case? So one of the assessment, you will assess the depth of that lesion. What other thing? If it is infected or not. What other thing? Size. Secretion. Presence of secretion. Is there any other thing? So
Do you have any surrounding?
any sign, tenderness. If tenderness is there. So anyway, when we are assessing the client skin, we have to see if for the first stage we can see a change in the color. It might be change in the color. You might see that edema is there in a polyprominent area. You might see redness or paleness. It might be tender on touch. And then if it is, in this case, what you have to assess, you have to assess the size of that area and the size of any sign of inflammation if it is present. If there is breakdown of the tissues, also you have to assess the site In which site is it? Which area? The size? How many centimeters? The shape? Because the shape, it will give us the cause of it. Because if it is like cut, in this case, the cut, it is not, definitely it is not a bedsore. It is due to other purpose, other causes, sorry. So the shape of it, the shape of the ulcer, usually it is irregular. Then the depth of it, if there is excretion, what kind of excretion? Is it a bloody excretion? Is it pus? Is there any smell for it? If there is excretion, also we have to get a culture swab in order to see what type of bacteria, in order to, for the physician, they will describe a treatment for that client. He will describe the antibiotic one. So according to the stages, so in stage 1 there will be change in the blood supply to the area, so due to the compression there, and then the necrosis will start, redness will start there, changing the color. Then in stage 2, some necrosis will start it, then the necrosis, it might go deep until it reaches the muscle. So in stage 1, an area of ischemia, erythema will be there, and skin temperature will be elevated. Tissue swollen down will also be there. Complaining of discomfort if the patient is conscious. Erythema will progress to gray. In stage 2, skin breakdown will be there, abrasion, blister, show edema also, drainage from the ulcer, infection may be developed also. Stage 3, ulcer extend into the subcutaneous tissues, subcutaneous tissue, which is the fatty tissue underneath. Necrosis and drainage continue. Infection might develop also. In stage 4, ulcer extend under the muscle to the muscle and the bone. Deep here, pore will be there, and infection develop, necrosis and damage will continue if we did not take care properly with it. As we mentioned before, for those patients who are confined to bed for a long period of time, especially if they are malnourished or obese, unconscious, having incontinence, those will aggravate the condition, and those are increase the possibility of having ulcer. So the factor affecting the formation of pressure sore, moisture, bad hygiene, if we are not taking care of the poor nutrition, body heat in case of fever, because sweating will be more and more moisture will be there. In case of anemia, it means that in this case the oxygen and will not reach properly. Immobility, if the patient is immobile, unable to move himself, because when we are conscious, when we are able to move, when we are feeling a discomfort, we will change our position. You as a student here, you are sitting in a chair. Sometimes you are moving yourself while you are still in your position, but you are moving yourself in order to decrease the pressure on some area of your body because you feel discomfort, isn't it? If it is for a long period of time. Even if you are sitting at home, you are moving from side to side in between. If you are sitting in front of the TV or you are reading or so that because you are feeling the discomfort. But if the patient is unconscious, he will not feel that discomfort. And even if he is conscious, but he is immobile, he is having some paralysis or something which is prevent him from moving, like if he is having BOB or traction and prevented from movement, in this case, how he will move himself. So those conditions, it will increase the possibility of forming Bedsore. Poor lifting technique. When we are changing the position of the client, if we are not changing it properly, in a proper technique, we will hurt ourselves and we will hurt the client. It might create a sharing force. Did you remember the sharing force in the beginning of the session? That sharing force, it means that you are forcing toward a side and there is another force which is from the bed, coming from the bed. Or that when you are trying to move the client, if you are not moving in a proper way and putting your hand in the proper area while moving, in this case also we will hurt ourselves. Because of that, even though when you want to change the position of the client, you have to change it in the proper technique. If the patient is heavy, you have to ask for assistance, for the help from others, from other nurses to change the position. Don't do it yourself because you might hurt yourself. You might, by the end of the day, you will go back with low back pain due to over stretching of the back muscle, even if especially if we are not using our muscle in a proper way. Incorrect positioning, as we said. Hard support surface. The surface that we are lying on it, if it is hard. Because if it is hard and flat, in this case, the pressure area, it will not be distributed for the whole body. If it is soft, the pressure, it will be distributed to the whole body. Incorrect application of pressure relieving device. Even the pressure relieving device, if it is incorrectly positioned, it will increase the possibility of developing Bedsore. Like if sometimes we are using rings, that ring, if it is not soft, if it is not properly fitted, in this case also it increases the possibility. So, as we said again, the factor that affect the formation of pressure sore, the hygiene, including the number of microorganisms present in the skin, and bacterial localization in the ischemic area. This will increase the severity of the Bedsore. So always we have to keep the client clean and not delay in the cleaning and giving bath for the client. Prevent moisture due to either if it is due to sweating or due to urine or feces or any drainage. Drain that is done, sometimes they are putting some drain to drain the fluid from the body after certain operation or surgery. So that drain, the serous fluid which is coming or the pus which is coming or whatever the drainage is there, if it is become in contact with the skin for a long period of time, also it will give irritation. So drainage and perspiration that reduce to the resistant of the skin to the friction. It will reduce the resistance to friction. Nutrition, inadequate nutrition also it will cause weight loss and muscle atrophy, and that will make the bone more prominent, and loss of subcutaneous tissue, pressure, edema, make the skin more prone to injury. So edema due to any cause, pyrexia, high temperature, it will increase the body metabolic rate, thus increase the need for oxygen, which already has the deficit. So the body is having deficit in oxygen, and this will increase the need for oxygen. It is not only that, because also pyrexia, it is associated usually with perspiration, with moisture due to sweating, isn't it? Anemia, decreased delivery of oxygen to the body cells, low hemoglobin, so it means that carrying oxygen, the ability of carrying oxygen will be less. The mobility also, the normal people can move when, as we said, when they experience discomfort, but in paralyzed person or unconscious client, they will not be able to move. So this will create the pressure. It will be stable in that area or one prominent area that is in contact with the bed or with the chair that they are sitting and confined to it. So patient at risk, paralyzed patient, malnourished patient, confined to bed, those who are confined to bed, patient over 85 years old of age, because their mobility also it will be reduced level of awareness, person who have confusion or due to medication that he is having, that he is taking. So the nursing diagnosis for patient with high risk for potential immobility problems. In general, here the nursing diagnosis says there will be high risk for this disuse syndrome related to paralysis and altered level of consciousness, self-care deficit related to muscle atrophy associated with prolonged immobility. Prolonged immobility, it will lead to muscle atrophy, and also prolonged bed rest, it will affect even the bone. So the calcium, it will start to go out of the bone instead of building up the bone. For the musculoskeletal tension, musculoskeletal system, potential for injury related to joint stiffness and pain associated with immobility. So also immobility, it will lead to stiffness of the joint if we are not doing exercise for the client. Did you took the passive and active exercise? Did you hear about passive and active exercise, isometric and isotonic exercise? No. So we'll come to them. About active exercise, it means that the person is doing it by himself and he is paying effort in doing that. When you are moving your body part and exerting pressure on them, in this case, it is an active exercise. But when the patient is unable to move and we are moving his joint and extremities, this is considered as passive exercise because he is not paying any effort. So this is the difference as passive and active. There is isotonic and isometric. Isotonic, it means that, what's the meaning of iso, by the way? Iso, what's the meaning of iso? In order to understand what's coming after it, you have to know what's iso. Iso, it means the same. It means that the same. Isometric, it means that there is no change in the length. Isometric, it means that there is no change in the length. Like, if I am lying on bed and forcing my legs toward the feet of the bed, in this case, there is no change in the length of my leg. But what's happened? There is exertion of pressure. The muscle is exerting pressure. If I am exerting pressure like this against the wall, this is also considered as isometric exercise. No change in the no change in the length. Okay. So the cardiovascular activity intolerance, in case of if the patient is having cardiovascular problem, in this case, he will not be able to tolerate activity. So he will become tired when he is doing activity. So this is activity intolerance related to prolonged rest. Altered tissue perfusion, peripheral related to interrupted venous flow, and secondary to deep vein thrombosis, might be due to deep vein thrombosis associated with immobility. So those are from the nursing diagnosis. For respiratory, impaired gas exchange related to static of respiration, because it will affect the respiration, or secretion associated with immobility. In case of immobility, there will be inability to get the secretion out. Infection, also airway clearance related to static loret secretion. Also metabolic and nutrition system, that we will continue with this, and after that you will get a break. Altered nutrition less than body requirement related to anorexia, secondary to associated with isolation, negative nitrogen balance associated with immobility. Altered nutrition potential to more than body requirement, imbalance of intake of various activity distribution. So I will give, you'll take 10 minutes break, and after that we will come. Okay.